Good morning, everyone. This is the MnCHOICES webinar Care Coordinator Workflow in MnCHOICES for today, March the 31st, 2025. My name is Teresa Vanderbandt. I am the MnCHOICES training lead, and I will present some of the first slides, and then I'll facilitate the presentation for the two presenters. So the Aging and Adult Services Division is hosting this webinar. Liz Sisk, the MnCHOICES Assessment Policy Specialist, and Chelsea Olson, Case Management and Support Plan Policy Specialist, will be your speakers for today. Let's go ahead and get started. We've worked to ensure that all of you are on mute. When it is appropriate, when there is a slide that says questions, we'll ask you to raise your hand in Teams, and then Sue Cavendro will call on you. She will ask you to unmute yourself, and then you can go ahead and speak. Before you speak, give us a little context. Tell us your name. Tell us who you work with. That will help us get a sense of where you're headed with your question, and it just helps facilitate the call. So here's our agenda for today. Our agenda is our audience, our care coordinators working for an MCO or an MCO delegate. Our purpose is to review the workflow in MnCHOICES, talk through some common issues users have and how to best resolve them, do some demonstrations of functionality, and help you find the resources you need to assist your work. So today's topics are going to be assignment, assessments and their corresponding support plans, timeliness, transfers, and resources. And please make sure you're on mute because otherwise I'm going to get a little bit of an echo. So thanks, everyone. So I'm going to do these first few slides and then I will hand the presentation over to your presenters for today. Wanted to take a few moments and talk about assignment and logging in. So the MnCHOICES database collects information from the moment you log in and starts connecting your work with that organization you log in as. So in this slide, it says Blue Plus, Health Partners, Medica, and UCare. In this example, I would work for all of those as an MCO delegate, and then I would select the one I'm working on a person record with. And in this instance, I've picked Blue Plus, and I work for Bluestone Physicians Blue Plus. And so MnCHOICES knows, okay, that's who you logged in as. Any work that you do on forms will then, in the background on the database, will have that information. So we always want to make sure you're working in a person record associated with the correct organization. So in this case, one of the MCOs and the location that you're working on. So why that's important is you're going to do work in one organization for a while, and then you're going to want to switch and do work for another organization for a while. What you need to do is go to the navigation header, and where the user drop-down menu is, select change account context, and then what that will let you do is switch to the next organization, the next location, and then be able to continue on your work. Why does that matter? You need to use it because otherwise, like I said, the background in the database, even if you're assigned the person to a location and a staff member, it'll still know that you've worked in that on that form logged in as someone else. So changing your context, taking the moment to switch to the next organization and then doing your work for that organization ensures that you don't impact billing, audits, or data in MnCHOICES. So it's really important that you use change account context. Okay, so assignments, person record, and assignment icon. So once you log into the application and you pick your location, what we wanted to make sure we had a chance to say is whatever data from login will affect the MCO data in Snowflake, and it will affect audit and oversight implications. So making sure you take the time to log in as the correct agency, and then make sure then that the location and staff assignments are made as well to that person record so that everything syncs up. All your work is clear that it's you who's working in it for this organization, for this person, both logging in and assignment. So this keeps your work neat and tidy, and it makes it so the data makes sense when we see it on the back end. So a question that we sometimes get is how to reach out to other staff. You can always go in the person record, go to the assignment icon, and go to the staff assignments page, and it will list who the care coordinator is for that person, or if there are other staff working, case managers or other things. You can do that. So I'm going to take a moment and show you that, and then you can write them a message in MnCHOICES, or you can go to the staff search and find their email. And so I'm going to give you an example in MTZ, just so you can see it, though it's going to look maybe a little odd. And so for folks, MTZ is the MnCHOICES training zone. Sorry, I'm just sitting over here on my other screen and logging myself in. So just give me a moment. Okay. I'll log in as care coordinator. So I'm just going to pick one of my made up people in MTZ, and they have staff assignments associated with them. So I went to the person record. I then went down to the assignments icon. I'm sorry, I did that awfully fast. So I went to the assignments icon here. I can see the list of staff here. They happen to all be me this time, but they could be somebody else. When I click on that staff member record, if I don't see anything here, which looks like I don't, I could go to I could look that person up. So let's say I'm looking up, I'm going to use user 40285 because we're in MTZ. We got these long numbers. I put the search to staff. I found this person. I can go look at their account and I can see their email if there is one. And if they have a phone number, I can see their phone number if I want to call them. The other thing I can do is go to messages. And in the inbox, then I could create a message and send it to that user. So I could do new message to user 40285, and then I'll probably have to search for them. So let's do that again. Search for them, locate them and select them. And then I can write my message and I can send it. So that way they can get it inside the system and they can go back to my dashboard and they'll see that the message is sitting there if I had sent them a message. So those are two ways that you can go look at and potentially message someone. And why this is important is you just want to make sure that if you're working in a person record and you have questions and you need to speak to someone else, you can. And so this gives you the way to be able to do that. And I believe I now have a handoff. So Liz or Chelsea, please go ahead and tell me when to advance the slide.
Thanks, Teresa. It's me. You can share your screen again, but I'm going to steal it from you right away. But you can at least share the next screen.
Okay.
And this is Liz Sisk, the MnCHOICES Assessment Policy SME in Aging and Adult Services Division. We're not going to spend much time on the health risk assessment, the standalone health risk assessment. This slide is mostly to point out the three statuses. It's different from the statuses of the MnCHOICES assessment or any of the support plans. We only have in progress, discard, and complete. And we wanted to point out that this HRA can now be reopened by staff with lead agency supervisor or delegate supervisor role. And now I'm going to steal the screen real quick. So we had some comments in that slide about if a person couldn't be located. And so that would happen in the assessment information section. As the assessment result, you either put the person declines a health risk assessment or they couldn't be located. Of course, if they completed it, you'd choose the health risk assessment completed, or we have the option for care coordinator change. Why this is important is a couple different reasons. These decline health risk or not located automatically completes your your requirements for the HRA. So none of these things have to be filled in because you couldn't reach them, but your completion requirements remain met. And then after that, you can simply choose it, go to complete. We have some more details in the slide about documentation, and that would be in the support plan HRA for the signatures. Teresa, you can bring the slide deck back up. Thank you. The next section that I wanted to talk about is the I am the care coordinator, need the staying healthy section. So this is a little bit of a change from when we first launched. We used to only have 2 options here. We now have 3. We have the options of yes, staying healthy only. That is generally used with care coordinators who are assessing somebody for EW. We have yes, staying healthy, notice of action, and signatures. That's the new option we have. That's generally used by care coordinators who are working on behalf of a county and is also the certified assessor. So these people are generally working with people on disability waivers. And then no. So no if you're not a care coordinator. The reason that we have this at all is for an efficiency for care coordinators. The staying healthy section in the MnCHOICES assessment meets the requirement for both the assessment and the HRA. And I am also just going to show some other functionality with this. So I'm going to steal the screen again real quick. I assume somebody will tell me if they're not looking at my screen. So I am in the assessment details subsection of the activity information section. We're in MTZ, so all the information we show today is fake people. I am the care coordinator and need the staying healthy section is yes, staying healthy only is selected. And when that's selected, what does not appear is the assessment and program acknowledgement. And then part of the assessment summary, specifically the notice, termination, denial, also does not show. This is a question that we got several times, especially for people who do also work for counties. And they've sent in help desk requests saying, these sections disappeared. I don't know where they are. I think something's malfunctioning with my assessment. This was completed by design. When you are working for an MCO, you use the MCO forms. However, if your hat is that you're a certified assessor for county, but you know you're the care coordinator and you want this built-in efficiency, you would choose yes, staying healthy, notice of action, and signatures. And then those sections reappear. So now we have a much more comprehensive DTR here, which is part of the assessment summary. And then you see this my mouse is glitchy. There we go. Then you see this assessment and program acknowledgement, which is required by counties. This also has the other county forms that are required to give a person embedded in it right here. I received the following at the time of my assessment. So that is why it does not show for care coordinators who are assessing people for EW, but it would show for care coordinators who are also the certified assessor at a county. You can show the slide deck again, Teresa. Okay. One of our common issues that we get, or I get as the assessment specialist, is that people write in saying, oh no, my case mix is displaying as an A, but when I go to enter it into MMIS, MMIS says it's an L. Is there something wrong with the assessment? So I'm stealing the screen once again. And this has never not been due to this one single question, and it's easy to get to choose the wrong answer. It's also one of the very last items you're answering before you finish the assessment. So it makes sense that it gets overlooked. But it is in the functional assessment self-determination section, informed choice subsection. And it's this one right here. Person is 65 or older, choice to stay on or return to a disability waiver. For people who are assessing people for EW, this needs to be not applicable. Person is not requesting to stay on or return to a disability waiver. These other options may be chosen if you have somebody over 65 on EW who is going to access a DD waiver, or you would choose person is choosing to stay on or return to a disability waiver if they're over 65 or under 65 and choosing to stay on or return to a disability waiver. But otherwise, for our EW folks, it has to be this one. This specific question here runs the rules for case mix. And so disability waivers do not use case mix L. So if you tell the system that this person is going on a disability waiver, these two options below here, you will receive case mix A. But this is the one where you would get the case mix L for those low level need folks who are accessing or being assessed for EW. You can bring this, thank you. I wanted to review our drop-down, our status menu. We have in progress, which allows you to make edits, screening documents saved, and eligibility run. MMIS ready, the assessment is no longer editable. We did design this for the screening doc being entered. Pending MMIS response, the assessment is no longer editable. That would be potentially if you have somebody else entering the screening doc. And if that person enters it and has a question, they could hit the request clarification button to move it back to in progress. Now, that's not the only way that you can use these statuses, but that is how it was developed. We also have approved by MMIS. This is what we consider, and you'll see one of these different headers down here. This is what we consider the status is completed and approved or closed. So approved by MMIS. We have had some difficulty with terminology and making sure we're still on the same page when we're using some of this new language. So our definitions is when is an assessment considered incompleted status? And that's really any status not in progress or incomplete. So if Teresa goes back one slide, you'll see that some of those other pending statuses, MMIS ready, pending MMIS response, or approved by MMIS, those are all not editable. So we consider that a completed status. Go ahead one slide, please, Teresa. Back one, what happened to it? There we go. Oops, one more yet. Forward. Thank you. But the approved by MMIS, that is the only one we consider closed. So it would be both completed and closed. Okay, next slide. Anybody have any questions about anything that we've reviewed so far, either the assignments, specifically why it's important to log in, or anything about the MnCHOICES assessment? Feel free to also ask about the HRA if needed.
Yes, please raise your hand. This is Sue Kavendru, and I will call on you if you have questions. Lori Kapsner, you can unmute yourself and ask your question.
So I work as a care coordinator in a county, and I'm just wondering on that staying healthy, should we be, if we're elderly waiver, if we're assessing for elderly waiver as the primary thing, should we be choosing the one with the notice of action and signatures per this, or do we only choose the staying healthy one?
Will you be the will you be the case manager?
Yes.
Okay. But you're working on behalf of a county? Or you work at a
Yes.
county, but on behalf of the MCO?
On behalf of the MCO.
Okay, so you are wearing your MCO cap, so you would still choose the staying healthy because you are working for the MCO.
So the yes, staying healthy only section, correct?
Yeah.
Okay, thank you.
Yep.
Roll Schliemann. Not very good at this, sorry. You can unmute yourself and ask your
You
question.
did fine, Schliemann. Yeah, I'm gonna piggyback on that last question. So, but I'm also doing the annual EW reassessment at the same time as I'm doing the MCO staying healthy as care
Correct.
coordinator and certified assessor.
Mm-hmm. So those two things are done as one. When you hit the yes, I am the care coordinator, need staying healthy only, or the other option, yes, I need staying healthy only, notice of action signatures. That will all display the staying healthy section. And remember that
Right.
staying healthy section constitutes the HRA between the assessment itself and that section. Yep. Okay.
I get that part. It's the part of not having the signature and notice of action on an EW assessment at the same time that was confusing me.
So you should be sending those things, but you should be sending your MCO forms.
Okay, but if our MCO forms are part of the MnCHOICES assessment, then it should be chosen on the assessment. Isn't that right?
The MCO's DTR is outside of MnCHOICES.
Right, the DTR.
Yep. And the signatures, my understanding is you guys are gathering that via the support plan, not on the assessment itself, since they're done at the same time.
Well, we used to do the 2727 for an assessment though. And this is what replaces that. I guess I can ask my MCO, my two
Okay.
MCOs, what they expect of us.
Yeah, and if it's something other than what we've understood it to be, our understanding is that this is what MCOs wanted. But if you feel, and especially if a lot of people feel that this is actually needed, then that would be a good thing for us to know.
Okay. All right. Thank you.
Yep.
We're going to take 2 more questions and then we'll be moving on. I have Bree Campbell first.
Yeah, this question is more about HRA, MCO HRAs. Going back to the putting it in if a person declined, not located. We have noticed a few of those that were not entered in 2024. Do you want us to have something entered in MMIS when they refuse or unable to reach? Or do we go back and add those missed ones for 2024?
Tina or Snip, do you guys have a preference on that?
This is Sue Cavendra. These are in calendar year 2024.
Correct.
And they didn't get put into MnCHOICES, you're saying?
Right. Yep.
Yeah. You know, we're not pulling a lot from MMIS any longer. So I don't. Could you put that question through the help desk so we can make sure and check with our MCOs about that too, because it's more related to data. And then we can get back to you on that. I'm just thinking at this point, it doesn't do a lot of good to enter it into MMIS. That if you can enter it in MnCHOICES yet, that's probably the best source of doing so. But I know that can sometimes cause problems too.
Yeah, well, I am with South Country, so we do have it tracked that it was done in our data system.
Yeah.
I just was wondering if you needed it in MMIS, but if it doesn't
No.
matter to you,
No.
then we're good.
Okay.
Okay,
That's good.
thanks.
Thanks for clarifying that. Yep.
Yeah, thank you.
Thanks. Pamela Serrar. Yeah.
Hi. Yeah, you pronounced my name correctly. Thank you. I just have a comment, I guess, more so for the MnCHOICES assessment. I'm a care coordinator, so I would pick the staying healthy section option. There is redundancy in the MnCHOICES assessment within the assessment and then the staying healthy section. I'm just wondering, has anybody commented on that and why that is? There's a lot of similar questions being asked within the assessment and then separately on the staying healthy section.
Oh, thank you. We have not been told that, but I see a lot of claps and thumbs up here. So we did try to remove any of that redundancy. So, but boy, tons and tons of claps. So please write in what you feel like is redundant. And if we can remove some of that redundancy, we will. I will say that there is another work group created to look at the HRA already. And anything that happens or is reduced from the HRA, the standalone document, would also apply to the staying healthy section. But I'd be happy to take your feedback about what's redundant and see if we can look at it and remove it.
Where would you like me to document that?
Just a help desk ticket.
Oh, okay.
It'll end up going through aging.
Okay. All right. Thank you.
Mhm.
So Sue, am I correct
Yep.
that I'm going back to the slideshow?
Yep. Back to the slideshow. Turning back to you guys. Thanks.
Okay. And the one thing I wanted to clarify, if you hear the subject matter experts say, please submit in a MnCHOICES help desk ticket, we would request that your mentor turn in that help desk ticket rather than individual people turning in help desk tickets. And so I just wanted to make sure I made that clarification.
All right, I think I am up. I'm Chelsea Olson. I am the Case Management and Support Plan Policy Specialist over in Aging and Adult Services. And I'm going to be talking a little bit more about support plan stuff. So a common issue that we see is that the assessment status when creating and revising a support plan. So the MnCHOICES assessment, when the care coordinator is ready to begin a support plan, they should run the eligibility and consider that the assessment details are complete. The MnCHOICES assessment status needs to be moved to pending MMIS response. The reason we don't want it to still be in progress is this ensures that the assessment is no longer editable, and it indicates that the program eligibility and assessed needs are documented. From there, the user can create a new form or revise the previous support plan if they're wanting to copy over information from the last support plan. The selections in the form builder are very important, so please pay attention to those and be mindful of what you choose. You can choose the program, the reason, is the person receiving other services and support plan types. Those are all very important things that you need to ensure you choose the correct one. Next slide, please. There are two options to complete a reassessment support plan. The first option is to use the Create Plan button, and that creates a brand new support plan. The support plan information from the last support plan does not copy over, so this is essentially starting a brand new support plan from scratch. If the person already has a support plan and it is annual or reassessment, they can also choose the Revise feature. And this is where they hit the Revise button, update it with the new effective date range after selecting that it is an annual or reassessment. And information from the previous plan will copy over with the exception of the plan owner dropdown, and then the effective date ranges of the services and supports and the EWRS tool. They will also have to update. The units will display from the previous support plan, but the dates don't. and you'll want to update the units, dates, and component services. So when creating a support plan, this is about program type. MnCHOICES is an off-the-shelf product with services tied to program type, which is why it is so important that you choose the correct program type. The program type dictates what services can be authorized. The program type is the program the person selected as a part of informed choice. And if the support plan is created with a program type and the person chooses to go on a different program, then the support plan must be discarded and a new one created. Likewise, if you accidentally choose the wrong program type, you have to discard and create a new support plan. So please pay attention to the program type and that you're clicking the correct program type that you are actually wanting to enter services for the person on. The reason for support plan. The reasons are annual reassessment, initial and transition plan. Most of the time, if you're going to be choosing annual or reassessment, unless it is a new person, then you'll choose initial. It's going to be pretty rare for you to choose transition plan at this point. Transition plan is only to be chosen when there is not a MnCHOICES assessment in this system. And at this point, everybody should really be doing their assessments in MnCHOICES. A lot of people get confused because of transition plan and thinking it's for transfers. It is not. So please do not use transition plan for transfers. It is only when there is not a MnCHOICES assessment in the system. And for support plan, is the person receiving other services? The best practice is to just select yes. This ensures that you can add services that are not covered by the waiver. So if there are services that are provided by the MCO, or if there's any services provided by a community service that is not a waiver service, selecting yes here will allow you to add that. And then we also have a little thing to refer you to the practice guide support plan for a list of what services can be chosen. Common issue that we see with support plan types here is support plan type should match the assessment in most cases. So if your assessment type is a health risk assessment, you should be choosing support plan HRA. If your assessment type is MnCHOICES assessment with a staying healthy section, your support plan should be a support plan MCO MnCHOICES assessment. And if the MnCHOICES assessment was selected, then you would choose support plan MnCHOICES assessment. The reason here is this allows more than one support plan type to be open at the same time. So please ensure that you are choosing the correct support plan type. When should they not match? For care coordinators, the only time when assessment does not match the support plan is when the person is assessed for the elderly waiver, but they end up not going on the elderly waiver. In this situation, your assessment type would be MCO MNA because you did the MnCHOICES assessment. But because they then chose not to actually go on the elderly waiver, then you would do an HRA support plan. And why is the MnCHOICES with the Staying Healthy section meets the criteria for the MnCHOICES assessment and the HRA.
I'm just going to call out here real quick, Chelsea, that this is not working perfectly. This is our best solution to this use case, and we are working on operationalizing this. So what I mean by that is we are aware that the 2 questions in the HRA About Me section do not pull over from the MnCHOICES assessment with Staying Healthy. And there can be some data issues with this, but we are working to make this better. We do not want you to have to do a whole health risk assessment after you've just done an entire MnCHOICES assessment with Staying Healthy. So this is still what the answer is. We have had some concerns that if they don't match, will this mess up our support plan signature sheet. I know we've had some issues with the AC waiver questions. And the answer is no. And the reason it's no is because those questions are not a factor on the support plan HRA. The health risk assessment doesn't assess for CFSS or waiver. And so those questions do not display on the support plan health risk assessment. And that is why this is not a concern.
So I'm going to steal the screen and demo how to create a new support plan. Right. So to create a new support plan, you use this new form button. Form category is going to be support plan. The form is a support plan. This is where I was talking about program type. Be sure you click the correct one because this will dictate what services are available. The reason, if it's a brand new person, new to the elderly waiver, you would choose initial. If it's annual or reassessment, you choose annual reassessment. Select your date range. We'll say this person renews 4/1, and we'll say it's for a year. You click next, and then you select here, is the person approved for moving home Minnesota? It's yes or no. It's just best practice to say yes. That way you can add other services if it comes up. And then the support plan type, you'll want to choose MCO MnCHOICES assessment. If it happened to be a HRA, we'd choose HRA, but in this selection, in this situation, we're doing elderly waiver. So it would be a MCO MnCHOICES assessment. And then you click save, and then that is creating a brand new one from scratch. Teresa, do you want to go back to the slides? All right, a common issue that we see is the effective date range, and we're going to go over some terminology here. The effective date range is located in the overview section, and this is the waiver or program span, and it should match the service agreement span. The effective date range of the waiver or program cannot be longer than a year, and generally, when a plan is revised mid-year, these dates should not be changed. It should still be the waiver span. Users can edit inaccurate data if needed, or if ending the waiver or program early. So for example, if you accidentally on that form builder that I just demoed, selected 3/2 instead of 3/1, you can update it here. Or if the person exited their waiver early because they passed away or they chose to end services, then you can update the end date. But you need to be aware that the service lines should be ended first. Otherwise, it could create issues with revising in the future. So please be sure that if you do end up changing these dates, which should be pretty rare circumstances, make sure you update your services first. Then these are the service lines that I was talking about. A service line is each service added to the support plan in the My Support section. The dates of the effective date range here are where the services, they may be shorter than the service or the support plan date span. So it does not need to be the full span. It is the dates of that service, when that service started and ended. If the person chooses to end that service before the end of their service agreement, you would go in here, end it with the appropriate end date, and then you can also add new service lines. So if they choose to switch providers mid-year, you would go in, update the effective date range in the services section for that specific service, and then you can add a new service if they switch to providers, and have those dates match when they started that new service. The service line dates should always match the service agreement. And then if the person transfers to another agency, that agency staff will follow instructions in the transfer guidance. Another common issue that we see is the support plan statuses. So this is just a little overview of the statuses. In progress provides an efficiency to allow care coordinators to start the support plan before the assessment is in a completed status. In progress assessment complete, you should only select this when the assessment is in a completed status. And that allows the assessment information to pull into the support plan. Do not move to in progress assessment complete if your assessment is not in a completed status. That will create issues. So, and you'll end up having to discard the support plan and start over. So always assure before moving to in progress assessment complete that your assessment is actually complete. Plan ready indicates that the support plan is finished, and it allows for care coordinators to enter the service agreement into their MCO system. And please note that the support plan and service agreement dates should match, as should all the services in the support plan should match the service agreement. Plan pending is also not editable, but this is the stage that you would move to if you realize that there is an error or something that you need to update or correct in the support plan. And from here, you can select Request Clarification. Selecting this moves the support plan back to in progress assessment complete, allowing you to make edits if needed. And then after you do that, if you did have any edits, you would then move the plan forward again into Plan Approved. Plan Approved is not editable. The service authorization is now approved and the support plan is finalized. This cannot be undone, nor can it be reopened. So once you get to this stage, plans must be revised to make further edits. And then discarded is meaning that you abandon your support plan, and this can also not be undone. So if you select discard, it is gone. We cannot reopen it. You just need to create a new one. And then refer to MnCHOICES Help Center Smart Guides for more information on support plan types. Required timelines. We get a lot of questions on timelines, so here they are. For the HRA, you want the status to be moved to complete. If it is SNBC, you have 60 days to do that. For MSC Plus non-EW, that is 60 days. For MSC Plus on EW, that is 30 days. And for MSHO, you have 30 days as well. For MnCHOICES assessment, you want your status to be moved to approved by MMIS. And this is 60 days from the assessment interview. And then for support plan, MCO, MNA, and HRA, these need to be completed and implemented within 30 days of the assessment. And we have some links to the contracts where all that information and verbiage is. The plan should be in plan approved status as soon as possible, and all updates after it is sent to the person must be made using the revised function. And then for assessment summary field date, when the care coordinator sends an assessment summary and the MCO and the support plan MCO MNA to the person at the same time, the assessment with the staying healthy section status is in pending MMIS response. And to update the date sent field, you'll want to move your assessment back to request clarification and update the date field. Then you can move the assessment back to approved by MMIS. And for the support plan, you'll move the status to plan approved. And Liz is going to demo how to do that. And again, this is just if you want to send it at the same time. If you're sending your assessment summary and support plan at the same time to the person, this is how to do that and to update that date field.
Thanks, Chelsea. So if you remember Chelsea stating at one of her earlier slides to move the assessment to pending MMIS status, let me do that actually. This is a reason why I actually seem to have a glitch going on right now. Let me sign out of this real quick and I'll share it in a second. Sorry about this. It got a little messed up when I was showing the differences in the care coordinator options. Let me fix it. Okay. Okay. So as I was saying, Chelsea stated in an earlier slide that once you're finished with the assessment, you might want to move it to pending MMIS status. So you would have it in pending MMIS response, and then you would have gone and worked on your support plan. You could have moved that support plan to in progress assessment complete because of course pending MMIS is one of the completed statuses. But what we have been told by care coordinators is that they want to send the assessment summary and the support plan at the exact same date, and they might not always know what that date is when they are finishing up their assessment. So now you've finished your support plan, you're ready to send both of them. Your assessment's in pending MMIS response. So you would go to request clarification, okay. And then go to the assessment summary. Change the date. Oh, I thought I was going to send it the 28th. I'm actually sending it the 31st. Save, print it off, and move your assessment all the way to approved by MMIS. You do not have to do this process. You can certainly send the assessment summary out beforehand. You can just choose a date in the future that you know you'd be, or you assume that you'll be able to send both of them by. Just make a note of that, and then therefore you don't have to go back and change this. But if you do need to go back and change it for some reason, that's why we say put it in pending MMIS response first. That allows you to go back. You don't have to worry about reopening it that way. You can do that yourself.
Awesome. Thank you, Liz. Teresa, can you share your PowerPoint again? I think I have one more slide to do and then I'm going to demo. So we can move on to the next slide. Perfect. So for the revise function, if you need to make a change to a support plan mid-year, this is how you do it. You use the revise function. And so for the reason, you select plan revision. Requires signatures, you select yes or no. And then the effective date range must be the same as the previous effective date range. You don't want to mess with those, especially if it's a mid-year update. If you're updating the goals or changing a service, you still want the effective date range to be the service agreement. So that is why it does have the previous effective date range listed. And then everything would copy over when you do select the plan reason as plan revision. Except for the plan owner dropdown, the support plan signature sheet if you choose yes, and then the signatures if you choose yes. So I will go ahead and demo how to do that. I'm going to steal the screen here. All right, so here is where you can see, this is my fake person. I have Tony Stark. And you go to this little tornado button and you choose support plan. This will filter it by all your support plans. You can see I have a few discarded ones. I'm going to go to this one, which is my plan approved one. And you select this little 3 dots and you hit revise. And the reason, I'm going to just say it's a plan revision. Our signature is required. This is up to you depending on what you are changing. If you are changing a service, you're going to want to say yes. Because the provider is going to have to sign it. The person needs to agree to the changes that you're making to their services. So really any services that you're changing need to be a yes. If it's a really minor update, then you might not need them. In this situation, I'm going to select yes, and I'm going to keep my effective date range because it is the same span. And I just do it that way. You select next, And then you answer these questions as well. And I'm going to keep it as MCO MnCHOICES assessment. And that is how you revise a plan mid-year. And it should copy everything over except for the drop down. Here, I'll move it to in progress assessment complete. And then you'll see everything is there except for the plan owner drop down and the signatures because I selected yes. And from here, you can go and edit whatever you need to edit, whether it's the goals or the services. You can navigate over here. All right, Teresa, can you share the PowerPoint again?
I was going to go into transfers, but do we want to take questions now? I feel like a lot of hands have been up for some time. It may make a little bit more sense to take questions now and then move into transfer help center resources.
Yeah, that's fine.
Okay.
All
let's do
right.
that.
Yep. Now the first person is Carrie. Unmute and ask your questions, please.
In regards to the chat, Liz has stated that they give updates during a care coordinator work group meeting. I'm just wondering when and where that is.
Yep. So those are held, they're monthly, right, Sue? With supervisors?
Yes,
Yep.
supervisors and managers at the MCO level.
And so we talk about things that are pertinent to care coordinators at those meetings. It's usually more of a collaboration. And then if there's any things that pertain to care coordinators directly, the expectation is that the managers and supervisors are disseminating that information to their teams.
Laura Perry, please unmute and ask your question.
I just wanted clarification on the service date spans for the support plan. So I know you said that it should follow the waiver span, but then PCA services have a different effective date than the waiver span. It's typically before the waiver span. So then I'm often having to cut like the start date of PCA CFSS services if I were to follow the waiver span. So just wanted further clarification on that.
Yeah, the services have to fit within the effective date range. So if it's like an elderly waiver, it should be the start date and end date of that service agreement. And then the effective date range for that specific service line can be edited within the services section. Is this for a waiver or is this just CFSS that you're talking about?
So yeah, if they have elderly waiver and CFSS, the CFSS aligns with when I do my assessment date, which is not the effective date of the waiver. So let's say I assess March 6th, that's the effective date of CFSS services. And then my waiver span could be 4/1. So then if I'm having the service agreement line and the support plan say 4/1, then it's showing that there's like 20 days of missing services from CFSS, if that's the effective date.
So CFSS, if you're using it as an entitlement, so you can use it before the person is open to the waiver, you do not have to do that. And so if that's what you're talking here, then the LTC screening document would be entered as no program. Thus, the type B service agreement needs to be entered, and then a CFSS support plan needs to be created. Once a person is open to an elderly waiver, then you need to close the type B service agreement and the services and the program span on the CFSS support plan and create that EW plan. So the effective date range in the overview section is either the program span or the waiver span. So But otherwise, if you are using CFSS solely as part of the waiver, you don't have to have 2 spans for that. That's only when you're using it as an entitlement, as something that's going to start prior to the effective date of the waiver.
Okay, I'm just making the comment. So if someone has been continually on the waiver, and if I'm adding PCA CFSS to the support plan, I'm just saying there's 2 different start dates and effective dates, because I follow that the start date of any PCA CFSS services is the effective date of when I do the assessment, and the waiver is the next month, first day. So there's going to be a different start date. And if I'm sharing the support plan with the member and with the CFS agency, there's going to be confusion within those date spans if that is what's supposed to be following. So I just want to clarify that information, just to make sure that there is that information shared with you guys of more of like an applicational knowledge of how this is actually being utilized across us care coordinators, and sharing that information with agencies.
Okay, and we just want to make sure though that the process is correct as well. If the person isn't accessing CFSS prior to the waiver, then the service line shouldn't be prior to the waiver. If they're accessing CFSS prior to the waiver effective date, then a CFSS only support plan needs to be created and then ended.
I understand. I think you're describing when I'm doing an initial assessment, this would be the example that I'm giving, and it would be an annual assessment. So they've been established with the elderly waiver for several years and have had PCA services. So just to clarify what just that difference of what that looks like.
Okay, so on a reassessment though, you would be putting in a CFSS start date earlier than the reassessment waiver span?
I'm so so going back to the example that I had, I said that, I assessed someone on March 6th, and that's the effective date of PCA services. Their waiver is 4/1. So if I'm having the support plan be 4/1 until 3/31, then the date span, like the service agreement lines of when it's authorized, because PCA follows the date of the assessment 365, then it's going to be slightly off skewed from when the date span of the support plan is. So if that's the case, then I'm just trying to like understand, to conceptualize exactly how those date spans really work, because obviously the waiver, that's important, but also making sure that the PCA date spans are correct.
Why don't you just send that one in so we can give you a better answer? But yeah, and we don't have to spend more time on it right now. I'd like home care to look at it too, but that is not how we have instructed to do it in practice. But I'd just like to take a better look at that and we can get back to you.
Okay.
Thank you.
I have 2 questions in queue. Do we want to take those now or continue on?
We can take them now,
Okay,
I think.
okay.
Yeah, and we can move on to transfer
okay.
guidance.
Harley Sullivan, unmute and ask your question, please.
So I was just curious if you have a member, so she was on waivers, so my MnCHOICES assessment was the identified her for waiver back in October. She was on it, so her support plan was the EW MCO. She, because of a new EW spend down, has decided to close her waiver effective February 19th. So I did DTR all the services and send the county info. My question is, now is my support plan the wrong type? And there would be a reason for me to redo the support plan mid year, or can I wait until I see her? And then obviously she would be an HRA and an HRA MCO support plan rather than the MnCHOICES.
So
If
you're
the
saying she
person-
exited, she exited the waiver?
Correct. Oh, I'm sorry. My name is Carly and I work for Medica as a care coordinator. And yes, she exited the waiver because she had passing of family that resulted in her receiving income monthly that created a waiver spend down that she did not want to participate in and closed her waiver.
Okay, so yeah, then you would close the waiver on the service agreement, close and update the support plan.
Yes, so I did go in the support plan, ended all the services, the effective date of the waiver, wrote that in her goals and everything. I was just curious because you had mentioned that it's important to have the right kind of document. And now my support plan is the EW MCO versus the HRA MCO support plan. So I just didn't know if that was gonna bother anything if I wait to do the different kind of support plan for her next assessment.
So I'm just trying to process this. So you should do the support plan HRA then. If she's no longer on the waiver, your elderly waiver ended, then you would do an HRA.
So
Support
mid-year, I completely close her other support plan and create a new support plan without doing a new assessment because she closed the waiver
Yep, and you do the HRA support plan.
without an HRA assessment though.
If you did the MCO with the staying healthy, that counts towards the HRA. So you don't need to do a new
Oh.
HRA because the staying healthy section counts towards the HRA. So,
Will
but
it
then when
let
she
me-
renews, then you would be doing an HRA.
Correct.
So,
Will it
yeah.
let me initiate a new HRA support plan
Yep.
without signatures because it's not going to be technically a revision, or can I go back and use the same signature from my previous assessment then, since I'm not doing a new assessment associated with this care plan?
For signatures, does HRA know that, Tina? If you're on.
I would defer to Sue.
Well, yeah, this is Sue. I've been thinking through this. And could she just do a revision of the support plan that's in there?
Yeah, she would revise the EW one.
Right,
No.
And
and
the
then couldn't
service
that
and the
just be the
lines, and then
support
do a
plan?
new HRA support plan.
She cannot do that because the support plan types are different.
Yeah, you can't revise the
Okay,
support plan to make
okay.
it a different type of support plan. So like you would be creating a
yeah.
new support plan with the program being HRA.
And I don't know enough to know whether a new signature would be required to do that. I think that's something we would have to test or look at. Because as she said, there was no assessment done.
Is this one you would like the mentor to send
Yeah.
in on a help desk
Yeah, you
ticket?
can send
Yeah.
it in and we can double check.
Oh, okay. Yep. Sounds good.
The last question we have is Trista Olmsted.
Hi, good morning. I had a change in my last name and everything is changed in MnCHOICES under my staff profile. But when I am creating support plans and revising support plans, the system seems to inconsistently be reverting my name to my previous last name as the plan owner. Sometimes it's correct, most of the time it's not correct. And I don't know if this is a comment or a question, but wanted to just bring that up and see
Yes.
if you have any
We are
insight into
aware of
that.
this. Yeah, we are
Okay.
aware of this issue, and we are working on it. It's been reported to our vendor, and it is something we're working on actively. That happens with the name change. So we are aware of
Okay.
that, and we're working on getting that fixed for the future in a future release. And so the workaround at this point was you can just manually correct your name. But it is something we are aware about, so.
And do you recommend when where we add ourselves as a contact, should we just update our information as a contact, change the last name, or completely delete our name as contact and add ourselves as a new contact with the correct last name?
I believe it pulls down based on assignments. Are you talking about like the plan owner dropdown?
No, I'm talking about like contacts. Like, so
Okay.
when we're in the assessment or in the support plan, like drop down boxes are tied back to contact.
Mhm.
And I feel like when I was just updating my last name in the contact, it wasn't always correctly using the information, but when I was deleting myself and re-adding myself as a contact, it was correct a little more often.
Okay. Yeah, you can
I
send it
don't
in
know.
as a help desk ticket and we can look into that. I mean,
Okay.
the contacts are editable. So if the
Mm-hmm.
name ever changes in a contact, you should be able to edit that. But
Yeah.
if you're noticing there's issues and it's not saving properly or something, I would send that in as a help desk ticket.
The,
Okay.
the other
Yeah.
piece that I would add to that is they could also use the effective date range in the contact. So let's say you had your name, your old name, and then your new name, and you had them as two separate contacts. You could make the effective date range for that contact,
Mm.
end on a certain date, which I think should
Oh,
also help it.
interesting. Okay, I can definitely give that a try. Can I ask one more clarifying question unrelated to names?
Yes. And I think after
Okay.
that, we might move on to transfers.
Okay. My question is, when um, when we're as a care coordinator opening up a MCO MnCHOICES assessment for CFSS, and it's a reassessment. I believe originally we were told to always select initial assessment because if we selected reassessment, there was an issue with MMIS entry. So I'm just checking if that is still the case, if we're for that particular role and program to still be selecting initial, or has anything changed with functionality having to do with that?
It is still the same. So
Okay.
if you're assessing for CFSS only, then it does need to be coded as initial assessment. It's something has to do with MMIS, and we are planning on addressing that so that actual reassessments can be coded as such. But that is part of the waiver reimagine work. So it's a couple years off yet where that will be fixed, but it's absolutely on our radar.
Okay, just wanted to make sure it hadn't
Yep.
changed. Thank you.
Yep, thank you for your question. All right, are we moving on? Otherwise, I saw one more
I think so.
hand.
I think we're moving on for now. We'll
Okay.
get the questions at the end.
Okay, so my main piece of reviewing transfer, the help center resource is that I know that some people were unfamiliar that this smart guide existed. So we have a smart guide titled Transfer Guidance for MSHO MSC Plus Care Coordinators. This was developed not as early on as we would have preferred, but pretty early on after the launch. And it gives guidance of what MSHO MSC Plus care coordinators need to do when there's been a transfer to them from a county or when there's been an MCO to MCO transfer. There are some other transfer guidance in there that was more when we were launching. So there was potentially a legacy assessment done and what were the steps on that. Next slide, please. So I'm going to review a couple of those scenarios. Transfers 1 and 2 are very similar. It's when a county or tribal nation completed a MnCHOICE assessment without the staying healthy section, and the support plan either was created, which would have been the MnA support plan, or was not created at all. And then it was transferred to the MCO. So for these scenarios, we're asking for an FNU to be completed. This is so you can get that care coordinator section. And then the program for the support plan would be elderly waiver. The support plan type is support plan MCO MnCHOICES assessment. The reason for this is because the HRA is duplicative of information in the MnCHOICES assessment, so this would create an efficiency. We know that care coordinators are not happy with the FNU function, but this is the way to get the assessment and the support plan to match. It gives you that opportunity to review the assessment officially and a way to update it and then meet your HRA requirements without having to do the standalone HRA, which would then require 2 support plans. So those are scenarios 1 and 2.
So Liz, just for clarification, FNU stands for Functional Needs Update.
Thanks, Teresa. Yep. And that is one of the assessment type options in the drop-down menu in the Initiate Assessment screen. I can show that if anybody feels that's helpful. If you want to raise a hand, I can show where that is. So far, no hand raises or thumbs up or any sort of reaction. It's fine. Transfer scenario 3, a county or tribal nation completed a MnCHOICES assessment without the staying healthy section, but a support plan was not created and the person did not use any long-term services or supports. Then they were transferred to an MCO. This is a time where the staying healthy wasn't in there. They're not using supports anyway, so we're going to keep things clean. The MSHO MSC Plus care coordinators would do the health risk assessment and then create a support plan to match, which would be the support plan type HRA as well as the program type HRA. And then the last scenario that I'm reviewing is scenario 4. We've gotten a lot of questions on this. So a county or tribal nation completed a MnCHOICES assessment without the staying healthy section and a support plan. And this person chose state plan services and was transferred to an MCO. So this again is we're going to have the care coordinator use that functional needs update to get the eye on the care coordinator section that we would responding to yes, staying healthy only. And then the support plan program would be CFSS, support plan type is MCO Min-A. We get a lot of questions about this because in the CBSM, we specifically state that an FNU cannot be used for state plan services. This is still true. And this is why, if you look at the transfer guidance, we say you cannot update those functional needs and you cannot update or enter a screening doc. It is not a real functional needs update. This is a workaround so that care coordinators can get the staying healthy section and have a matching support plan. We did receive special permission from the home care team to use this, but again, this is more of a workaround. This isn't a general, this isn't something you would use outside of this very specific scenario. I think Teresa's going to take over.
Yep, I am, but I want to show one thing. I want to make sure that we're all on the same page of some level setting. Any of the resources that we've talked about today, if you go, I'm in the training zone. This is the navigation header. If I go to help and I go to help center, training resources live here. So if you would like to see the transfer document that Liz mentioned, I just put transfer in the search. It's the easiest way to do it. And then it has right here, Smart Guide, transfer discharge, transfer for MSHO and care coordinator PDF. That's the one you want. And see, it says right here, provides transfer scenarios and instructions for MSHO MSC Plus care coordinators. You can either view it and then it's available and then you can search. So you can search in it or you can download it. But if you download it, please know that we do update these from time to time and then they get a new version number. Like this one shows it has a different version number. So just be cautious about downloading and keeping them long term. Download them to review them and then maybe get rid of them. But those two options are available. And I just wanted to show you that's where your resources live that you often hear us talk about. That's where practice guides are. So again, if we go here and we do practice guide or smart guide in this. So if we do practice guide in the search, the practice guide for support plan and HRA will come up. And then if you want to do smart guide, you can put in smart guide and there's a bunch of them in here. And then specifically, then here are the support plan smart guides. So I just wanted you to see those and how to find them yourselves. So, and that's what this is about. So how do we define what the heck these things are and how you use them? Practice guides really are there to navigate and complete specific forms. And so they're a little more in depth. They give you a little more content. They give you a little bit more instructions about completing those pieces. And they exist for each of the forms, for HRA, the assessment, and the support plan. Smart guides are step-by-step instructions. So first you put an X here, then you put a thing there, then you pick this drop-down menu here, and it goes through them piece by piece. Again, there are support plan smart guides per each support plan type. So one for support plan HRA, one for support plan MCO, MnCHOICES assessment, and one for support plan MnCHOICES assessment M&A. There's also the transfer document, the transfer guidance that Liz has just been walking you through. Secondly, the current functionality and future enhancements document is the document that's got all of the current issues and any kind of workarounds that they would have. And they are all again in here. If I do current, just to bring it up, it'll have the current functionality document. If you haven't used this before, I really recommend you take a time to sit and look at it. And then it will have the date. It's updated every release. And so it's updated for things that are removed and things that are added. So if you're wondering, gosh, is that an issue? And are they aware of it? Please go here. And again, there's a search function so you can search. There's also a table of contents. So it gives you a chance to see, and it's by specific heading. So it gives you a chance to see each of those. So that makes it easy to use this document. And it's the first question we ask mentors. If something gets turned in, has the person looked at the current functionality and future enhancements document? So I believe that that is everything and that we are ready to take additional questions.
Wendy Gornowitz, please unmute and ask your question.
You had a name change from Wendy Palm to Wendy Gernovich, and the plan owner will not reflect the married name. So in context, I've deleted them. I've changed end dates. When I go to plan owner, I put my number in, I put my name in, and there's only the option for Wendy Gernovich is the pull down option. Hit save, go back and look, and it reverts to Wendy Palm. And so I can pull down the change again, put my Wendy Gernovich in, hit save.
Wendy, we're aware of it. Yep.
Yeah. So,
Yep. So no, I think I worked with you on it when we first identified it. So yeah, we're aware of the issue and the vendor is aware of it and we are looking for a fix for it. So for now, you just have to put your previous name in and then hand correct, as you heard Chelsea say earlier.
So I just heard her saying that you could correct it. I was like, you can't. But here's the tricky part is if I put and I save it, if I save it, I can't revise it. I mean, if I revise it, I'm revising the wrong version. If I save it with the correct one and I upload it to Caseworks, and Caseworks has the corrections, but because you can't revise ones saved as an attachment.
Yeah, and so like I said, right now we're aware of it. You are likely for anything historical to always have your previous name display. So the vendor is looking at it, but currently we've reported it in. It's going through the process. So that's all I can tell you about it currently.
Oh, okay.
Tiffany Fletcher, will you please unmute and ask your question?
Can you hear me okay?
Yep.
Yes, we can.
Perfect. I wanted to request clarification to make sure that I was not advising the team wrong. Someone is fee for service assessed with MnCHOICES, not staying healthy. has an elderly waiver support plan, is accessing elderly waiver services, enrolls in an MCO. Previously, the service ban date when we did the functional needs assessment would be changed to reflect the MCO functional needs assessment. So let's say there's 3 months left of their previous elderly waiver span. That would be, in my case, it's typically Prime West. They enrolled Prime West February 1st. Previous span ended 5/31. Is that changing?
I'm trying to make sure I understand your question. So you do an FNU with an effective date of the FNU, right?
Yes.
Okay.
Correct.
And that does not extend the waiver plan. So it would just be changes from that date moving forward if there were any. But it would not extend the waiver plan or the waiver span, I should say.
So that's not what I'm asking.
Okay.
Previous guidance, April of 23, number 5 says previous county agency coordinates the closure of SA with new tribal agency or whatever. No, wrong one. Sorry. Number 7. The previous county and tribal agency closes elderly waiver service agreement 1 day prior to the managed care enrollment span date as shown. So
are you looking at I'm blanking on the date, like 6387. Which document are you looking at?
6037A.
Okay.
So if you go to the smart guide and transfers or whatever, and you scroll to the bottom, it still populates that one.
Mm-hmm.
And then the updated smart guide transfer guidance doesn't actually give specifics about the date span that would be being used.
We are also updating that 6037 to make it more clear about what people have to do. I think I'm still missing what the actual question is or what the discrepancy is. So if you want to write that in, I can process it a little bit better. I don't have the 6037 up.
That's fine. I can try to explain it better. I can't type in the chat, or I would have, but someone is assessed MnCHOICES, fee for service, has elderly waiver. Their span date is 12 months, give or take whatever days. They enroll in an MCO 9 months in. In the support plan for the MCO.
Yes.
Are we still saying that when they were assessed initially, not through the MCO, is that when that date span is still occurring once they've enrolled in the MCO? Or are we changing it to the functional needs when we do that, and then that support plan is created from the functional needs update?
Okay.
With just those 3 months left. So I'm asking for clarification for the service date span of the MCO support plan.
So I heard you, but I'm also gonna go back to the waiver dates plan. So the waiver date span would not change. It would not reflect just those 3 months. It would be the entire waiver span. And then the services, if they changed providers or they stopped receiving them, or the functional needs update gave them a different case mix, which needs to be adjusted for assisted living, then the service spans would change for those. And then of course the fee-for-service case manager and case aid, if they had it, would close on the waivers, on the waiver, those services. But the waiver span itself would be that entire span, not the 3 months. But it's possible that yes, the services are those 3 months.
That is what I needed.
Okay,
it is a little bit different than was advised previously, so I will change that.
Okay, great.
Thank you.
So knowing that we
We-
just have a couple of minutes left.
We just had one question left. I don't know
Okay.
if we wanted to do the one last question.
Try it.
Okay, Lacey, do you have a quick question?
Hello, my name is Lacey. I am an MCO care coordinator with an MCO delegate county. And some of us have noticed that when we open a new support plan for an individual that has recently been assessed for a MnCHOICES and has also had a waiver support plan opened, their CFSS information and budget is pulling into the MCO HRA support plan. And I'm wondering, I guess, if this is something that's happening to others and if it is something that's supposed to happen, or if you want it deleted somehow through like exporting to a Word document. Just would kind of like some feedback on this.
Do you
So
need
we
her
have
to submit it in?
no, we have seen this happen. And what we're seeing very, very, very frequently is that when people are choosing a program, they're choosing program HRA, which is correct. But then when they're choosing the support plan type, they're very frequently choosing MCO MnCHOICES instead of support plan type HRA. And that's when you're getting the CFSS information pulled onto the actual plan. Having that said, we did just notice that in the print, even when the support plan type is correct, meaning the program type is HRA and the support plan type is HRA, that the CFSS is showing up in print, which is incorrect. And I think Tina has written is addressing that with our vendor. But
Okay.
aside from print, if it's actually in your plan, I'd encourage you to look at which support plan type was chosen.
Okay. And yeah, it was only happening in the print.
Okay.
That's when we were finding it, because otherwise we weren't finding it
Okay.
as we were editing. It was once we were printing and then kind of reviewing things that we would see that.
Yep. Yes, we are aware of that and addressing that with our vendor, but thank you for pointing that out.
Okay. Just wanted some feedback. Thank you.
Yep.
So
All right, Teresa, you're closing us out. Thank you.
I am. Yep. We are at time, and so I just want to have you be aware of a few things. There is training information available by role in the MnCHOICES County link page or partner link page, and then just here's some basic information. Oh, I wanted to share that we have brochures and videos in other languages for MnCHOICES. So if you do have people who speak a language other than English, we have 7 languages for brochure and 3 for video on what is a MnCHOICES assessment. So please go to the MnCHOICES People We Serve page, click on it, and take a look at what's out there. You might find those useful resources for yourselves. And then CFSS does have an office hours, and as well as we wanted just to provide you information for other frequently asked CFSS questions. They have a frequently asked questions page you can use. And that is the end of our presentation. So thank you everyone for joining today. It's very much appreciated, and we look forward to future conversations with you.
Thanks, everybody.